From the early days of colostrum, rich in antibodies, to mature milk that supports their ongoing development, breast milk evolves to meet your baby's needs. Breastfeeding also offers numerous health benefits for mothers. It can help reduce the risk of certain cancers, promote faster postpartum recovery, and even aid in weight loss. Choose a position that feels relaxed and natural for both you and your baby. This can make a significant difference in how well breastfeeding goes. There are several positions that you can try, each with its own benefits. Experimenting with different positions can help you find what works best for you and your baby. A common position is the cradle hold. This is often one of the first positions new mothers try. In this position, you support your baby's head in the crook of your arm, allowing for close contact and easy access to the breast. You can also try the cross-cradle hold. This position is similar to the cradle hold but offers more control over your baby's head. This position allows you to guide your baby's head to your breast more easily, which can be particularly helpful in the early days of breastfeeding. Other positions include the football hold and the side-lying position. Each has its own unique advantages. The football hold is especially helpful for mothers who have had a cesarean delivery. It keeps the baby away from the incision site, reducing discomfort. The side-lying position is perfect for nighttime feedings. It allows you to rest while your baby nurses, making those late-night sessions a bit easier. Using pillows for support can also enhance your comfort. Placing a pillow under your arm or behind your back can provide additional support and make breastfeeding more comfortable. Nursing pillows are specifically designed to help position your baby at the right height, reducing strain on your arms and back. Creating a calm and relaxing environment can also contribute to a more comfortable breastfeeding experience. Soft lighting, a quiet room, and a comfortable chair can make a big difference. Supporting your body. Proper support is essential for your comfort, especially during those long feeding sessions. Use pillows to support your back, arms, and neck. A pillow behind your back can prevent backaches. A pillow under your arm can take the weight of your baby off your arms. A pillow on your lap can raise your baby to the height of your breast. Don't hesitate to experiment with different pillow arrangements until you find what works best for you. Remember, breastfeeding should not be painful. If you experience any discomfort, adjust your position or seek help from a lactation consultant. Positioning your baby. Positioning your baby correctly is crucial for a good latch. Your baby should be tummy to tummy with you. This means their chest should be touching yours. Make sure your baby's head is in line with their body. Their ear, shoulder, and hip should be in a straight line. This alignment helps your baby swallow comfortably. Support your baby's neck and shoulders. Do not push your baby's head towards your breast. This may cause them to resist latching. Let's delve into the criteria for a good latch. A good latch is crucial for effective breastfeeding and comfort for both you and your baby. Here are the key indicators. The chin touches the breast. The mouth is wide open. The lower lip is turned outward. The areola is more visible above the mouth than below. By ensuring these criteria are met, you'll help your baby feed more efficiently and reduce any discomfort you might experience. Cherish the skin-to-skin contact, the eye contact, and the feeling of closeness. Breastfeeding is more than just feeding. It's a beautiful expression of love and nourishment. Remember, you are doing great. Pay attention to your baby's hunger cues. These cues indicate that your baby is ready to feed. Some common hunger cues include rooting, sucking on hands, and making lip-smacking noises. Rooting is a reflex where your baby turns their head towards anything that touches their cheek. When you notice these cues, bring your baby to your breast. Do not wait until your baby is crying. Crying is a late sign of hunger. A proper latch is essential for comfortable and efficient breastfeeding. A good latch ensures that your baby is getting enough milk. It also prevents sore nipples. Hold your baby close to your breast. Wait for your baby to open their mouth wide. Their mouth should be wide like a yawn. Bring your baby quickly to your breast, aiming your nipple towards the roof of their mouth. Your baby's chin should be touching your breast. Their nose should be free to breathe. Breastfeeding is a learning process, and challenges are normal. Many new mothers face difficulties as they and their babies adjust to this new experience. Some common challenges include sore nipples, engorgement, and low milk supply. These issues can be frustrating, but they are usually temporary and manageable with the right support and techniques. Sore nipples are common in the early days of breastfeeding. This can be due to your baby not latching on properly or feeding frequently. Make sure your baby has a good latch. A good latch can prevent sore nipples and ensure your baby is getting enough milk. Apply a lanolin cream to your nipples after each feeding. This can help soothe and heal sore nipples, making breastfeeding more comfortable. Engorgement occurs when your breasts are overfilled with milk. This can happen if your baby is not feeding often enough or if you miss a feeding session. It can cause your breasts to feel hard and painful. Engorgement can also make it difficult for your baby to latch on properly. Frequent feedings and warm compresses can help relieve engorgement. You can also try expressing some milk to reduce the pressure. Don't be afraid to offer the breast often. Especially during growth spurts, your baby may want to nurse more frequently. This is completely normal. Trust your instincts and respond to your baby's needs. On-demand feeding is about following your baby's lead. It's about creating a nurturing and responsive feeding relationship. How long should a breastfeeding session last? This is a common question among new mothers. There is no one-size-fits-all answer. The duration of breastfeeding sessions can vary greatly. Some babies are quick and efficient eaters. They may drain a breast in just a few minutes. Others may take their time, feeding for 20 to 30 minutes or even longer. Let your baby set the pace. Trust that they will let you know when they are finished. Don't worry about trying to time feedings or force your baby to stay latched for a specific amount of time. The key is to focus on responsive feeding. Pay attention to your baby's cues. Allow them to feed until they show signs of fullness and contentment. Breastfeeding is a wonderful gift you can give to your baby. The World Health Organization recommends exclusive breastfeeding for the first 6 months of a baby's life. This means your baby only needs breast milk. No other food or drinks are necessary during this time. After 6 months, you can start to introduce solid foods. However, continue breastfeeding alongside these new foods. Keep breastfeeding until your baby is 2 years old or older. It's a journey that benefits both you and your baby. Breast milk is the perfect food for babies. It has all the nutrients your baby needs to grow and thrive. Breastfeeding also helps to protect your baby from illnesses. It strengthens the bond between mother and child. Remember, every drop counts. Continue breastfeeding for as long as you and your baby desire. It's a gift that keeps on giving. Monitoring your baby's weight is important. It helps to ensure that they are getting enough milk. Your baby's doctor will weigh your baby at each checkup. In the early days, it's normal for babies to lose a little bit of weight. However, they should be back to their birth weight by 2 weeks of age. After that, they should continue to gain weight steadily. If you have any concerns about your baby's weight gain, talk to your healthcare provider. They can help you determine if your baby is getting enough milk. Remember, every baby is different. Growth charts are just one tool to monitor your baby's progress. Trust your instincts and don't hesitate to reach out for support if you need it. By following WHO's recommendations and understanding your baby's needs, you can embark on this rewarding journey with confidence.